Hello, how are you? I'm great, thanks. Okay, so you are here for ear, nose, and throat examination, is that correct? Okay. Your general physician suggested that you get one. Not really because you're having any issues, just because it's a good idea to get one every so often just to make sure that there are no underlying issues, maybe that you don't know about, maybe that's causing a problem that you're unaware of, that only a ENT doctor can see. So you are aware of how this works, correct? I'm going to be checking your ears, your nose, and your throat. All three of those work in unison together for your sinuses. They help with the passage of fluid through your cavities in your head and down your throat. And there are several different components to that, different blood vessels, capillaries, the cartilage in your ears, your nose, the different palates within the back of your throat, everything that works together to do that. And sometimes it just needs a closer look to make sure everything's working properly. Okay? Alright, so as I'm checking everything, I'll be asking you questions. I'll just wait and ask the questions as I'm checking each area instead of going through a checklist at the time of, before we do the exam. So, let me just get my gloves on. Okay. The first thing I'm going to be checking is your ears. But I will ask, do you normally get a cold? Maybe once a year, twice? Like normal. Okay. Any sinus pressure with it when you get it? That's perfectly normal. Okay, so I'm going to start with this otoscope, and it's just got a little light on it. I'm sure you're very familiar with them. It's the same ones that they use at your normal physician's office. And I am just going to start with your left ear here. So, give me a second, I'm going to get close. Okay. So I'm just going to be looking very carefully in your ear. The first thing I'm going to do is be pulling down your lobe gently. And I'm going to be just sticking the otoscope lightly in your ear. You shouldn't feel any pain. Okay. And kind of rubbing the outer part of your ear, the outer part before you get to the canal. All of that seems fine. Do you have any pain when I rub on your ear, the upper part? What about around the lobe? No? Okay, I'm going to be looking further in at the canal area. Everything seems normal in there. I don't notice any type of issues with your earwax. You look like you've got a normal production of it and it's not impacted in any way. So that's good. And, let's see. Okay, I'm gonna look further in. Your eardrum looks normal. It doesn't look infected or swollen. Do you ever get earaches? Okay. Do you ever get them with a cold or anything like that? Okay. Did you ever have tubes put in your ear as a child? No. Okay. Do you ever get earaches after maybe swimming? Going underwater? No? Okay. Alright, I'm just gonna do one more look in this ear. Make sure everything looks normal. Okay, good. Okay. Moving on to your right ear. Just continue to hold still for me. Pull your lobe down. Look in. I don't see anything, any issues on the outer part of your ear. And I'm gonna pull, I'm gonna rub. Do you feel anything odd when I rub? Upper ear, your lower ear. Okay. Okay. Right, now I'm going to look further in with the otoscope and look inside your canal. The inside of the canal looks normal. I don't see any swelling. I see a normal amount of wax production. And none of it looks impacted, so that is good, just like the left ear. Okay. Now I'm going to look further in. Your eardrum, and it looks healthy. I don't see any type of swelling or issues with the eardrum, so that's great. Okay, so for the most part your ears look fine. I say for the most part, your ears look fine. And you didn't have any issues with the outer part. The inner part looked normal and healthy. You didn't have any complaints about anything going on with them. Have you had any type of dizziness or vertigo at all lately? No, in the past year. Okay. Okay. Okay, so this next part that I'm going to do is be checking your nose. When I'm examining your nose, I'm checking the outer part and the inside part of it. And what that's going to consist of is me touching and checking the outer part. I'm going to be checking the bridge of your nose, the outer part of your nostrils. I'm checking to see about the airflow, like what, how it would be going up into your nose, and what obstructions it would encounter in your nose, because everybody's nose is different. So I'll be looking at the bridge, the outer part. I'm going to then be looking at the inner part of your nose. First the very front inside part of your nose with just my fingers, and then I'm going to take a small camera and look further up in your nose, but it's not going to hurt at all. But that's just to see even further back that I can't see with the naked eye. Okay, so give me just a minute. I'm going to put something on my hands so that it doesn't hurt rubbing latex on your nose. You know, I don't want it to rub you. Okay, so if you'll just look straight ahead at me, just rubbing your nose. sense of it and feeling of it. You don't have any pain, do you, when I rub the sides of the bridge of your nose? Okay, good. This side. The other side. Okay, good. No pain on the bridge of your nose. Okay, go ahead and look to the left for me. I'm going to examine the slope of your nose. Okay, alright, and look to the right. Okay, alright, now take my thumbs and kind of rub right here, right in the outer part of where your nostrils open. Sorry. You don't have any pain right there. If I rub right at the entrance of your nostrils, do you have any pain? No. Okay, alright, that seems normal. Okay, now what I'm going to do is I'm going to start with each side of your nose. I'm going to just start with the left and then I'll do the right each nostril. Take one finger and I'm going to just lightly press it up in your nose and pull your nostril open. Okay. I'm going to take a small pen light. Actually, the otoscope light that I used earlier. And just look inside. So if you'll just hold your up for me, it's good. Just pulling your nostril open and I'm looking in, checking to make sure the mucus production looks normal. The walls of your nostrils don't look inflamed. Capillaries look normal. Let me know if I'm hurting pulling your nose, but I'm trying to be as gentle as possible. Okay. Capillaries, mucus production, the cartilage right at the top looks normal. Looks like the passage of air would not have any issues. Did you have any nosebleeds as a child, or do you have any now? Okay. Okay. All right. Let's check the other one. Lightly stick my finger right there and pull your nostril open. Slightly. Just pulling it open. Looking up in the very front part of your nostril. I'm looking at the walls of your nose. I'm looking for mucus production. Checking your capillaries. Make sure they look normal. And the cartilage at the top. It's fine. Okay, so let's do this part quickly. I'm gonna close your nose closed, and I want you to breathe in and out of your mouth. And then when I let go, I want you to breathe deep in and out of your nose, okay? Closing your nose, breathe in your mouth, and out your mouth. In your mouth, Now out your nose. Okay, good. Again. In your mouth. Deep in. Out your nose. Okay, right, that's fine. Okay, now the next part I'm going to be using a pin light that's attached to a camera and my laptop over here, and I'm just going to be looking. It's just going to go about right there, and that's just so I can see a little bit further up in your nose, okay? It shouldn't even trigger. I'm really good at not triggering anything. Like, you shouldn't even feel like you have to sneeze or anything, okay? So just hold still for me. I'm going to go up in the left side. Okay, keep holding still. Just looking. Sure everything looks fine. Everything seems normal. Mucus production looks normal. There doesn't look like any blockages to the airway passages in the back. Okay, that's fine. Right now, let's go up the right one. Okay, hold still for me. Good. Right. Everything looks normal. The very back looks normal. Airway passages look fine. Okay, alright, that's great. Okay. Alright, so the next part that I'm going to be taking care of, clean off my device here, is going to be your throat area. I'm going to first be looking down your throat, see if I see anything on the inside, and then I'm going to end it with checking the outer part of it. I'm doing that one a little bit in reverse. It tends to be the best way for me to check it. Okay, so I need you to open your mouth as wide as you can. I may stick my finger. Sorry. Stick my finger. There you go. Okay. Looking all the way to the back of your throat. I see you still have your tonsils. Have you had any issues with that? No? Okay. Have you had strep throat at all in the past 2 years? No? Okay. Have you ever had strep throat that you know of? Okay. Some people are carriers of it. Okay. Right, all the way to the back. Continue to open as wide as you can. Good. Say ah. Good. Okay. Now, say ah and continue to just go ah. Watching the vibration in the back of your throat. Okay, that's good. All right. Everything looks fine with that. Okay, now I'm about to check the this part right here, which would be where drainage happens around your ear area, and then it goes down your throat. I'm feeling there for any type of obstruction or swollen lymph nodes, anything like that. Hold your head up for me. Just doing a light pressing right behind your earlobes. Rubbing. Oh, pressing down. This is also one way to move lymph in your lymphatic system. You can do that once a day, actually. Pressing down. Oops. Down. Good. Good. Any pain? No? Okay. What about down here? No pain in your lower part of your throat? Okay. Alright, I'm going to hold my hands right here. Swallow. And again. Squeeze a little bit harder. And again. Okay, good. Just feel in the movement of your throat muscles. Okay, alright, that seems fine too. Okay, so what I can tell, everything looks perfectly normal. It was still a good idea for your physician to send you here to have it checked, just in case. But I will send the information back to them so that they know everything was fine with your ears, nose, and throat, the whole system. But if you do tend to have issues or something reoccurring that you've got a problem with, you can let your family physician know, and they can schedule you another appointment with us, okay? Okay. All right, you can just check out at the front.